Hello, everyone, and welcome to the Open Dental webinar for DoseSpot integration. My name is Brad, and my co-organizer is Kylie. So today what we're going to be doing is we're going to be showing you the DoseSpot interface, how that's going to work, how you're going to see how that interacts with Open Dental, the program, and how you're able to see your patients' profiles and information update at the same time. All right, so a couple things. So this is our patient that we're going to be using today. We'll just call it DoseSpot training, just so you can see who we're working with. What you see in here is this is a, first off, this is a prescription that I wrote previously in Open Dental directly without using DoseSpot, because I want you to see how those are going to be transferring into DoseSpot for you. All right, so I am signed in as a provider. At the top of my screen, you'll see it says doctor. Again, there's different permissions and roles that both doctors and non-providers are going to be having, and I'm going to start by showing you your doctor capabilities. So I am in the chart module for my patient. What I can do to access the DoseSpot interface, in the upper left-hand corner of the screen, I've got a button that says ERX. I'll go ahead and click that to launch the DoseSpot interface. All right, so this is the interface for DoseSpot. A couple of things to point out. In the upper left-hand corner, we have the name of the provider. This provider's name is Steve. Down below that, we have our patient information, because this is going to pull any information from Open Dental. So again, only the patient you currently have selected will come over into the DoseSpot interface. So here's my training, DoseSpot training. I get a gender and I get an age. If I click this plus icon, I can get more details about my patient, including the date of birth, address, and any phone number that my patient has. So really easy to get that contact information. Just to the right of that, I have allergies. These are only entered into DoseSpot. They don't come from Open Dental. So if your patient does have an allergy or a medication allergy, feel free to add that in here. So when you're prescribing, you're not getting any bad interactions with medications. And we can do that by hitting the Add Edit Drug Allergies button. And over on the left side, it's going to again show us any current allergies the patient has, which are none. I'll go ahead and type a allergy. Let's do, so I'm going to do amoxicillin. One thing you'll notice is that I'm not needing to type in the full name of my drug or my allergy. I can just type the first 3 letters, and the same theme carries throughout the program, where we can just type a couple letters and it'll present me with options to select. So I'm going to select amoxicillin. Down below, I can indicate if this is an active or inactive allergic reaction. And we'll just say we have an allergy to amoxicillin. You can type additional information such as reaction and onset date. Those items are not required. Only the items with the red asterisk are technically required. I'll go ahead and hit save. And now you'll see over on the left-hand side, my current drug allergies, I do see amoxicillin. So if you're done adding your allergies, you can hit the close icon over here. And you'll see at the, again, top of the screen there, I have amoxicillin listed as my current allergy. You can also preload your pharmacies. You can also select your pharmacy when you're dosing at the end of when you're actually ready to send your script. And that's what I'm going to do here, just so you can realize that you don't have to do pre-setup when you're actually sending. It's just a smooth ride from beginning to end. The next box we have is coverage details. This item is going to import automatically your patient's medical insurance if found. Again, there is a chance that it won't be found, but it automatically imports from the SureScripts network, which is a network in which many, if not most, scripts are sent, so it should pick it up fairly easily. And what that's going to do for you is that's going to indicate the type of coverage as far as what type of medications their insurance is going to cover, whether they cover a specific type of drug or a specific formulation in a drug as well. All right, and we're actually going to go down lower. So this is our active medications. So Open Dental does have two-way syncing for medications. So any medications that I create in Open Dental will sync through and carry over into DoseSpot. So this is one that I had previously entered in directly in Open Dental, but it is able to pull up more detail for me directly into DoseSpot. So again, single entry will take you all the way through. I can see that this is something that wasn't prescribed directly in DoseSpot because under the status section here, I have these kind of looks like a chat box really, and it says self-reported. I can always click on that status to get additional details, when it's active, when that actually happened, and if there aren't any additional notes. So again, that all information is all going to come through for me. I can also see over on the far left side, if I click on my drug itself, if maybe it's a drug that I'm unfamiliar with, I can bring up the lexicon for dentistry. And this is basically your A to Z on drug information for basically any drug that you can come across. So this is going to cover any interactions, what the use is for. It also gives you prescribing guidelines. So this is going to work for existing medications as well as whenever you're dosing anything new out, you can go through and you'll get your access to your lexicon to make sure that whatever you're prescribing fits the criteria. Okay, so I think that covers the active medications. You do have the inactive medications. So whenever a medication becomes inactivated, you'll be able to see it here. Things don't just disappear. So you'll always get to see a nice history for your patients. And the next screen here is the medication history. This is a really, really neat tool. So this is going to allow your providers or your staff to actually import the patient's current medical history when it comes to scripts. So oftentimes patients won't know all the specific names or drugs that they might be on. What'll happen in here, if you come into here and the patient gives you consent to pull in their medical history, and you hit show medical history, it's going to import their currently active medications, again, through anything that's been sent through the SureScripts network, which is most prescriptions. And when you pull them in, it's going to give you the self-reported. So it'll let you know that they're not something that you prescribed personally from DoseSpot. And those will actually carry all the way into Open Dental itself. So it doesn't just live here, it goes all the way back and forth. So again, very cool tool. And that medication history, again, just make sure you click the box to give consent and then show the history. All right, so I think we're now ready to move on to adding prescriptions. So what I'm going to do in the upper right-hand corner, I have the Add Prescription button for my patient. I'll go ahead and click that. In this testing environment that I have here, I do have this additional field enabled. This is an optional field. This is where I can throw in my ICD-10 code for my script. So I'm just going to type in tooth. And again, like I said, with lots of this, again, a lot of how this is going to work is you type in a couple letters or maybe a word, and it's going to do the search for you. So you don't have to know all the details of exactly what you're looking for. Let the system work for you. So I'm going to do disturbances in tooth. Now this next one, again, this is where I'm going to be looking for my medication itself. And again, it does let you know that you can just type three characters. So just to cause an issue, because I know that we're allergic to amoxicillin, I'm going to prescribe amoxicillin or attempt to, and you'll see how that's going to work. So I type the first three letters, AMO. Select what version of amoxicillin you're looking for, whether it's a capsule or a tablet. Again, it's going to give you a lot of different selections, so you've got choice. So I'm going to hit amoxicillin, my oral tablet. Next is the currently accepted strengths of amoxicillin for this specific format, the tablet. So I'll do a 500. Now we can select the effective date, and what I'll do is I'll just mark today for the effective date. Patient directions. This is where you're going to type out items like take one, tab, BID, until gone. Again, pretty straightforward there, something that you're most likely familiar with. Down here, our next section is dispense. So total number of tabs being dispensed, I'm going to do 14. It automatically selects the unit, which is right here. You do have many different options, but again, let the system work for you. So let it select that one for you. For any reason you are using a drug where it does not automatically select, you definitely have a very large variety of dosing formats. In this case, I'm going to do the next field, which is going to be refills, and I'll do 0. Day supply is going to be 7. So now we have diagnosis, my medication, which is amoxicillin, 500 mil. I'm doing 1 tab BID until gone. Total of 14 tabs with no refills and a 7-day supply. If you need to add, sorry, 1 second. If you need to add a pharmacy note, you can definitely do that here. And keep in mind, the pharmacy note, that just goes directly to the pharmacist. It will not be something that is printed on the label itself. Something, again, to be aware of. And I can just access it by clicking this little plus icon. And what I'm going to do is, since this is going to be a drug that I prescribe often, I'm going to save it as my favorite. Right here, save as favorite, just the star icon. Now I'm going to save this medication. It's set up just the way that I want it. What's nice is when you save it as a favorite, I get to call it anything that I want. So in this case, I'm just going to call it amoxicillin 500 or Amox 500. because that's what I normally call it. That's something that's easy to recognize when I'm searching for a medication. So what you see now is that has created a pending medication, and it has all the details of the drug that I've created here. I've got my drug, my dispense date, who's actually prescribing it, all listed here. You'll see that since I do have an allergic reaction to amoxicillin, I do get a flag up here. I've got a drug allergy interaction. So it's, again, letting me know that I am allergic to amoxicillin. But we're just going to push on through just to get the dosing set up. So during your registration process, all the providers will be creating 4-digit PINs. A PIN is just a personalized code that you'll enter in anytime you need to send a prescription. That's going to be right here. And this does let you know anytime you're missing information. So in this case, for this drug, I have not selected a pharmacy. So if you're trying to send the medication, it grays out the section that would actually send the medication. And at the top of the screen, in pink or salmon, whatever you want to call it, it lets me know that I don't have a pharmacy selected for my patient. So anytime you've got some sort of error or issue, the system will try to do its best to let you know the specifics of your issue. So I'm going to now give my patient a pharmacy, because like I said, we can add it at the beginning or we can add it at the end. So I'll go ahead and hit change pharmacy. Currently, I don't have any pharmacy selected for my patient. So in the upper right-hand corner, I'm going to hit search pharmacies. So let's say I'm looking for Walgreens in Oregon. Now keep in mind, this is a testing environment, so this search functionality might not work for me, but I guarantee you it will work for you. So I'll look for a Walgreens in Oregon. I'll hit search, and perfect, we found one. I have a Walgreens test in Portland. So again, this database that you have here, it is a very large database that is constantly updated. So you shouldn't have any problems when a patient tells you what pharmacy they need it sent to, in getting in touch with that pharmacy or being able to send to that pharmacy. So I'm going to select my pharmacy just by clicking on the name. And now you'll see that on this script, I do see that this one says Walgreens Test Portland. So now when I click the box, I don't get any error messages to indicate which ones I'm trying to send. So I want to send this one here. I'm going to put in my 4-digit PIN. Again, something that's created when you finish the registration process. And now I'm going to hit approve and send. So now you can see that we're down at the bottom section here at the top and down the bottom. This is the script that I'm sending right now. Again, it covers the details of what I'm sending. I can click over here if I don't remember what pharmacy I had sent anything to. I can hit view pharmacy. Gives me the details, contact number, and fax number. I can also see, because you're going to be able to see this information from different users can always see this information. So I can view the prescriber to see who actually had prescribed that medication. So here's my provider information. Again, details of the script itself there. And then looking at the status section, again, I can mouse over and see what's happening with my medication. It currently is listed as sending. I can click on that item to get more details. Now, again, I'm in a testing environment, so I definitely expect myself to get errors when trying to send this. and that's what's happening here. But you will see, you get a nice log of what's happening from beginning to end. So I entered it in my medication, I attempted to send it, and then I got an error message. Again, this is what I would expect to happen in my testing environment. In your environment, you're going to be able to see when the medication makes it to the pharmacy. It'll update the status here to a checkbox. Okay, so again, this is all from the perspective of a provider. For my non-providers, I'm going to hit close. Actually, before I get to the non-provider, one thing I do want to point out is because we did have an error in the upper left-hand section when I'm looking at ERX, now I could be selecting at any patient within Open Dental, but since I'm the provider, I'm going to see the notifications that affect me. I have a ERX with the number 1 next to it. I can click this drop down and I can see if I've got any pending medications, which again, I'll touch more in just a quick second here. If the pharmacies have actually requested any refills, I can fill them here. And then transaction errors. So I can come into here, go directly into my transaction error. I've got just one item. And now I can see the details of what's going on. I can see what I'm trying to describe, what happened here, the error message. I can hit view to go into that patient. And now I can kind of try to figure out what's happening in this situation. So obviously this one aired out, so I get a notification here. So I'm not going to be able to resend that, so I can either print that out or remove it. I'm going to, again, close that one down. So I'm going to switch over to a staff member to show you the differences between a provider and a staff member. So again, I'm just going to use the same patient. I'm going to come to ERX. Anytime a non-provider is trying to access the interface, they're going to get a selection window where they choose the provider they are wanting to send on behalf of. So it's going to default and highlight the primary provider for the patient you have selected. If for any reason, you're wanting to send the script to a different provider or on behalf of a different provider, the list will be displayed there. So I'm just going to use my provider 1. And again, I am signed in as somebody else, and I can still see the details of my patient. Again, it's all here. So I'm going to add a prescription as a non-provider. This time I'm going to show you a controlled substance, but this time I'm going to pull it from my favorites list. So as I did with the prescribing as the provider, and I click that little box to save as a favorite, this is how your favorites are going to show up. The additional item is when I have a lot of favorites. Let's say I've got 50 favorites. I can come over here, and as I type in my favorite name over here, it's also going to filter out my favorites over here. So I can have 500 favorites, and I can easily sort through them by searching through my medications over here. But I'm going to use this one over here because this one's already set up for me. You'll see that it pulls in my existing favorite options. It saves my directions, it saves my dispense, my refills, my day supply. If I had a pharmacy note, it'd save that in for me as well. So it takes care of all that for me. I'll just gonna hit today for the effective date, which is required for any controlled substance. Just because I'm in a testing environment, I have to change that, but that's not a normal thing that you'll have to do. Again, you'll just hit today, and it'll work just fine. And since I have this box enabled, I'm required to put in a diagnosis. And again, this is something that's just enabled for me. One moment. There we go. And I'll go ahead and save the prescription. So again, I am in as a non-provider. So you'll notice I do not have any printing or sending options available down at the bottom of the screen here. I can select my pharmacy, I can add the drugs, but I can't actually send it myself. What I need to do is I need to be signed in as the provider, which they're going to also see again from any screen. Right here, I have a pending prescription. So I've got the error that I still haven't taken care of, but I also have a pending prescription here. It tells me the details. I can view, I can see who entered it in. Right here, that's the script. And this specific drug is a controlled substance, and currently Walgreens Test Portland will not accept controlled substances. So I can hit change pharmacy. So this is one that I already have selected. I'm going to actually search for a different one. I'm going to click this box here. So I'm looking for a controlled substance capable pharmacy. I'll just do search because I don't care which one I'm sending it to. And now I've got an interface here. So now this is one that's going to be accepted. So I'll select my drug, type in my PIN, approve and send. Now, since this is a scheduled drug, all providers will do what's called a two-factor authentication to send it. So you'll enter in your PIN, and this is giving a confirmation of what you're sending, and you're going to have to sign off on it. So we'll hit ready to sign. Again, you'll enter your PIN one more time. And then during the setup process, you're going to be using an application on your phone called Duo Mobile. And that application will have a 6-digit code that cycles every 30 seconds roughly. And whenever you look at the code, you just enter in whatever code it displays at the time, enter the code in here, and sign and send. Unfortunately, I can't show you this actual sign and send because I am not a real provider, but this will send it off for you. And that is how you're going to be doing any prescribing in Open Dental using the DoseSpot interface. Like I said, that we are always here for you. I almost guarantee there's going to be a question here or there that come up. And again, don't ever feel like you're asking too many questions. Questions give you answers, they give us answers, and it does definitely help us improve our ability to give you the best possible experience. So again, thank you again for joining us for this webinar, and feel free to reach out to us anytime you need, and we'll be here for you.